The Chief Medical Director of Edo Specialist Hospital, Dr. Anthonia Njoku, has strongly refuted allegations circulated on social media, which allegedly sought to maliciously tarnish the reputation of the hospital, its Chief Medical Director, and the Governor of Edo State. BTV News host Sarogi Agwebo reports that Dr. Anthonia Njoku denied the allegations during a press briefing with journalists at the hospital, where she disclosed that since she came on board with the support of the governor, the hospital has made significant progress in delivering healthcare services to the people. The report.
As I speak to you, since I came on board, I've never had any security aid. I don't have any, so I don't know where the security is being paid for, Madam Accountant. I don't know where I don't know, have you been paying for security for me?
Addressing journalists, the Chief Medical Director of Edo Specialist Hospital, Dr. Anthonia Njoku, in company of other management staff of the hospital, described the alleged circulating video on social media made against the hospital, herself and Governor Monday Ukpebulu as malicious, laughable, and a figment of Mr. Obazee imagination mixed with a lot of lies. Dr. Anthonia Njoku said when she came on board as the Chief Medical Director of the hospital 3 months ago, she inherited a debt of nearly 500 million naira and faced challenges with vendors who were unwilling to continue providing services with the hospital. But through effective communication, they convinced them to stay, ensuring uninterrupted healthcare services. She said in the last 3 months, under her leadership, the hospital has made significant progress, which include increase in patient encounters, reactivation of the intensive care units, fully functional laboratory, and routine maintenance of equipment. Dr. Njoku expressed gratitude to Governor Monday Ukpebulu for his support, vision, and commitment to enhancing healthcare in the state.
My attention that was drawn to a video circulating on social media space by one Mr. Albert Obazee, whom I do not know. I don't know him because I really don't follow him, but I heard about him talking about Edo Specialist Hospital and myself, trying to malign my name, Edo Specialist Hospital, and my dear governor. I want to start by saying that when we came in December, just about 3 months ago, we inherited a debt, a lot. What we met on ground was quite massive. I would say the debt is close to 500 million, where we had that debt we had to grapple with because a lot of these vendors did not want to continue to provide services to Edo Specialist Hospital. We had meetings with them and we talked to them on the need to continue to provide services where they can. And when I saw all of that, I said, wow, this is a big problem. From pharmacy alone, it's about close to 300 million. Then you have other places, consumables and all of that, and that is why I said the debts are close to 500 million. The government is looking into that. The government has a listening ear, but there is a problem because they were run by consultants who were paid, to render these services, and the government needs to know that, oh, okay, these people, we gave you so and so money. What happened that you did not pay these vendors? The right thing has to be done. We need to find out what these people that were managing this place, which monies were paid to, how come they accumulated so much debt? Was it an intent to run the place down, or was it what could have happened?
In relation to the alleged relationship between the Health Management Association (HMA) and the Edo Specialist Hospital, Dr. Anthonia Njoku said in the health sector, collaboration is very necessary in delivering healthcare services. She also denied the claims by Mr. Obazee that she paid a lot of money for personal security. She described the allegation as unfounded and laughable.
I told the DPRS, please pull out data for me. I need to have this press conference. And I was surprised that in 3 months, we have been able to increase patient encounter with about 8.92%. OPD attendance rose to about 11.27%. And our new patient, that's the number of new patients that come to the hospital, increased to about 9.5%. Even our admissions have increased to about 3.81%. Because we've been doing a lot of rejigging, rejuvenating, and reviewing our processes. Mr. Governor has really been very supportive of this Edo Specialist Hospital. I make bold to say that when we came on board, for over 1 year, what we met was that our intensive care unit was not even working, and and that meant that some surgeries we will not be able to do. But we are now able to do that. You heard the anesthesiologist speak to that. Another thing again that I think I needed to address was the issue of when he made mention of HMA and our relationship with HMA. I'm not the one that started this hospital. This hospital, from inception, about 6 years ago, has been on a special status where they report directly to the governor. And I think one of the reasons is not any bad thing. It is because to try to reduce bureaucracies because of the nature of this hospital. This is a specialist hospital, one tending to be a tertiary care. And because of that, this hospital, you do not need to have a lot of bureaucracy. Another thing again that was said is that that we pay a lot to security, my security. In fact, he actually brought it to my fore because I never really put a lot on that. As I speak to you, since I came on board, I've never had any security aid. I don't have any, so I don't know where the security is being paid for, Madam Accountant. I don't know where I don't know, have you been paying for security for me? So, but as it is now, with people like this, I think it is paramount that I have some security. So maybe he has called my attention to that and it will be taken seriously. So I really don't know where Obazee gets his own information. But, it's a free world and people are free to talk.
Also, an anesthetist at the hospital, Dr. Omosayi, spoke on the reactivation and upgrades of the hospital's facilities.
The recently purchased ventilator came in about 2 weeks ago or thereabouts. And since then, we've been able to do about a couple of surgeries. We've been able to nurse one critical patient, even though the patient was an in-house referral on one of our departments here. In the past, we have had to refer that patient into. So as it stands, the good thing is, apart from the PTH, DSH is the other hospital that I know that has.
Dr. Anthonia Njoku expressed gratitude to Governor Monday Ukpebholo for providing essential equipment including air conditions and transformer to the hospital and urged those misleading the public and opposing the governor's effort to refrain from doing so and instead support the governor in moving the state healthcare forward. Osarugie Agwebo reporting for BTV News.